In recognition of National Manufacturing Day, more than 170 events will take place today across California. Hosted by manufacturers of all sizes, these events will showcase to the next generation of workers the exciting possibility of careers in manufacturing. Manufacturing is the bedrock of the American middle class. In California, the industry employs 1.3 million people and pays on average $96,000 a year, almost double the state's average salary. California-made products can be found all across America and in every corner of the globe. In fact, last year the manufacturing industry was responsible for $142 billion of California's exports, a nearly 15% increase over the previous 6 years. Manufacturing is on pace to create 3.5 million new American jobs over the next decade. But even as the industry grows, there is expected to be a shortage of almost 2 million people to fill those open positions. Advances in technology and production have changed the face of traditional manufacturing. This has led to an increased demand for higher-skilled workers, particularly those with science, math, and technical backgrounds. Many of those jobs could come to California, supporting both our workforce and the needs of the manufacturing industry. Thanks to our state's vibrant technology sector, California is in a unique position to prepare our workforce to attract those 21st-century jobs, but we have to make the necessary investments now. California is already home to 2 of the nation's 14 manufacturing institutes, which foster partnerships between the public, private, and education sectors to advance manufacturing and promote long-term sustainable research and development. And thanks to the efforts of Governor Jerry Brown and California Community College's Chancellor Eloy Oakley, the Strong Workforce Initiative is helping companies work more closely with community colleges to develop a curriculum that provides students with the skills their company needs to grow. One great example of this is the partnership between Las Positas Community College and the Lawrence Livermore National Laboratory. Recognizing an impending shortage of machinists, Lawrence Livermore partnered with Las Positas and the Alameda County Workforce Development Board to create the Vets to Tech program to train veterans in advanced manufacturing and machining. Now in the program's 3rd year, many of these veterans have either begun careers at Lawrence Livermore manufacturing parts for the lab's engineering department or are pursuing their bachelor's degree. We've seen similar success to this approach in San Diego, where San Diego City College and Taylor Guitars partnered to address a shortage of computer numeric control, CNC, machine operators in the region. Taylor worked with the college to develop a curriculum to train students in CNC operation and guitar manufacturing. As a result, Taylor Guitars is not only able to hire the workers they need to grow their business, but nearly every student graduating from the San Diego City College program finds a good-paying job within the San Diego manufacturing industry. California, however, can't do it alone. Support for federal programs, like the Hollings Manufacturing Extension Partnership, MEP, will be key to our nation's success. This program facilitates partnerships between federal, state, and local stakeholders to help manufacturers reach untapped markets, embrace groundbreaking technology and increase the value of their products. In 2016 alone, MEP contributed to more than $9 billion in sales and facilitated $3.5 billion in new investment for manufacturers across the country. It's important we continue to support manufacturers and manufacturing workers by promoting collaborative partnerships across multiple sectors and supporting robust federal investments in programs like the Hollings Manufacturing Extension Partnership. I would encourage communities across the state to get to know their local manufacturers to understand the role they play in the economy and how support for technical education can lead to high-paying, secure, and meaningful careers. Manufacturing Day is an important opportunity to recognize the value of manufacturing and its workers to our nation. I'll continue to defend, support and grow manufacturing in California because a strong manufacturing industry can continue to be the cornerstone of middle-class economic success. Special Counsel Robert Mueller, the former FBI director investigating possible connections between Russian officials and President Donald Trump's campaign team, is now reportedly looking into a scandalous dossier containing explosive, unverified allegations regarding Trump and his associates. CNN and NBC News reported Thursday that Mueller's investigators have spoken to Christopher Steele, the former British spy who compiled the dossier. A separate report by Reuters said Mueller's team had taken over the FBI's inquiries into the dossier as part of the special counsel's investigation into whether Trump associates had colluded with Russian officials to influence the 2016 election. The document, which Trump was informed about shortly before his inauguration by then FBI Director James Comey, alleges compromising details about the president and his ties to Russia, including claims that Trump associates did indeed collude with Russians. It also alleges that Russian officials are sitting on damaging information about the president, including accusations that Trump hired a number of prostitutes to perform a golden showers, urination, show in front of him while staying in a hotel suite in Moscow that was under surveillance by Russian intelligence. The dossier's claims have not been substantiated, and Trump has vehemently denied the allegations, calling them totally made-up stuff. According to the CNN report, U.S. intelligence officials took the claims alleged in the document more seriously than previously indicated. The Senate Intelligence Committee has also attempted to contact Steele about the dossier, Committee Chairman Richard Burr, RN.C., said Wednesday. Unfortunately, the committee has hit a wall, Burr said. The committee cannot really decide the credibility of the dossier without understanding who paid for it, who are your sources and sub-sources. Burr added that he hopes Steele will eventually decide to meet with the committee. Congress's failure to reenact the Children's Health Insurance Program is putting states in a tough bind. By failing to reauthorize the Children's Health Insurance Program before last week's deadline, Congress has nudged the state of Minnesota toward a painful solution to the loss of federal funds. Unless it can find $95 million, the state said it will continue to provide full health care for certain low-income pregnant women in the program, while either reducing the number of children eligible for CHIP or scaling back their benefits. That is the sort of agonizing choice that all states in the country will face in the coming months unless Congress acts quickly to restore federal funding to a program that is immensely popular with both parties. With the U.S. Senate distracted last month by another Hail Mary attempt by Republicans to repeal and replace the Affordable Care Act, Congress didn't get around to reauthorizing CHIP by the September 30 deadline. And that has left states contemplating how to keep the program running when the federal funding runs out, if they can keep it going at all. The clock is ticking, Joan Alker, executive director of the Center for Children and Families at Georgetown University, said. The longer this goes on, the bigger trouble states are in and more consequences we will see. Some states will have to start notifying families early next month of coming disruptions in eligibility or benefits, she said. Committees in both the House and Senate this week began to consider measures that would extend CHIP funding. According to The Hill, bipartisan efforts in both chambers to reach a solution that would resume CHIP funding have faltered, diminishing chances for a quick resolution. CHIP is a joint federal-state program that provides health coverage to low-income, uninsured children who live in families whose income is too high to qualify for Medicaid. It covers nearly 9 million kids and 370,000 pregnant women across the country. It costs about $15 billion a year, with the federal government picking up nearly 90% of that tab. Medicaid is also a matching program, but at a lower federal rate. Those enrolled in CHIP are entitled to the same medical services as Medicaid recipients. Unless Congress steps in soon, Minnesota said it would run out of CHIP funds by the end of October. And Arizona, North Carolina, and Utah will exhaust their federal funding by the close of the calendar year, according to the nonpartisan Medicaid and CHIP Payment and Access Commission, which provides legislative analysis to Congress and the U.S. Department of Health and Human Services. Other states, with more carryover funds from last year, estimated their CHIP funding would expire by the spring. Emily Piper, commissioner of the Minnesota Department of Human Services, sounded utterly exasperated with Congress's failure to act in time. When you look at the people most urgently impacted, she said, pregnant women and new moms, having this uncertainty looming over them at a time when they need that certainty to live their lives and care for their babies, it is really a disservice to them. Without the federal funds, Minnesota was preparing to adopt some drastic measures to keep the program operating. Piper said the state was planning to continue offering full services to the 1,700 pregnant women in CHIP, but to scale back either the eligibility of kids in the program or the services they would be entitled to. About 125,000 children are in Minnesota's CHIP. But then the Centers for Medicare and Medicaid Services informed the state earlier this week that it would send an additional $3.6 million in CHIP money from unused funds that had been distributed to the states between 2014 and 2016. The additional money would enable Minnesota to hold off any changes in the program until the end of October, the State Human Services Agency said. Arizona, with about 88,000 kids in CHIP, said it too had recently learned it would soon receive redistributed funds, to the tune of nearly $22 million, which would enable it to run its program unchanged until the end of November, according to Heidi Capriotti, spokeswoman for the Arizona Health Cost Containment System, which runs the state's Medicaid program and CHIP. Utah has also said it expects to receive redistributed funds shortly, which Colby Young, a spokeswoman for the state's health department, said would enable the state to continue the program until the end of December. If Congress doesn't act by then to resume CHIP funding, the program, which serves about 20,000 kids according to Young, would shut down, she said. North Carolina, with a CHIP enrollment of more than 256,000, has not received redistributed funds, according to the state health department, and it too is expected to run out of funds this year. Nevada, where nearly 69,000 kids are in CHIP, also expects the money to run out by the end of the year, according to Cody Finney, a deputy administrator for Nevada's Division of Healthcare Financing and Policy. Without federal funding, the choices would be of course to find another mechanism to pay for those benefits, meaning using state resources, Finney said, or wind those benefits down. Other states, where funding was expected to last into 2018, said they would continue CHIP as usual while hoping Congress acts before they have to make any decisions. The good news for Pennsylvania is that we have a few months here, said Teresa Miller, acting secretary of the state's Department of Human Services, because our funding won't end until February, and we are confident that CHIP will get reauthorized. But if Congress doesn't act, CHIP programs around the country will be imperiled, according to the Kaiser Family Foundation, which analyzes health policy. For example, the nonprofit said, by state statute, the loss of federal funds would require West Virginia, like Utah, to terminate the program. Arizona would be required to freeze enrollment. Other states might be forced to follow suit, Kaiser said. Unlike the Payment and Access Commission, Kaiser estimated that 7 states in addition to the 4 listed above would run out of funding this year if Congress doesn't act. But one of the 7, Mississippi, disputed that, saying it has enough CHIP funds to last through the end of April 2018, according to Aaron Barham of the state's Division of Medicaid. Health policy experts credit CHIP and additional funding for the program included in the Affordable Care Act with helping to decrease the uninsured rate among children. Between 2013, the year before the ACA was implemented, and 2016, the share of kids without health insurance dropped from 4.8% to 3.8%. In 1996, the year before CHIP's enactment, the uninsured rate among children had reached 14.8%, an all-time high. Before the Senate became embroiled in the latest effort to repeal and replace the ACA, known as Obamacare, Republican Senator Orrin Hatch of Utah and Democratic Senator Ron Wyden of Oregon announced the outlines of a bipartisan deal to keep CHIP funded. The proposal would have extended CHIP funding for 5 years, although it also would have gradually eliminated extra funding from the Affordable Care Act. Hatch is chairman of the Senate Finance Committee and Wyden its ranking Democratic member. Their committee was one of those expected to take up CHIP funding this week. Sign up for exclusive state policy reporting and research.